Think about making an IFAK video. This is Kane 1906, and welcome to Medical Monday. This Medical Monday, we're going to be talking about the IFAK, Individual First Aid Kit. Do you have one? Do you know how to use all the equipment that's actually inside of it? Well, if you don't, or if you want to learn how to build one, stay tuned, because this one is for you. Today, we're going to be talking about the IFAK, the Individual First Aid Kit. What's the significance of the IFAK, and why is it important? When you look at TV, you're always seeing that, hey, I got an IFAK, but their IFAKs are always different. What's the significance of that? Why is this person IFAK totally different from this person IFAK? Is there uniformity? What's the contents of it? Is there certain things you should have in it? That's what we're going to learn today. So when it comes to the IFAK, we're looking at the IFAK itself, the makeup, and the actual uses of the IFAK. So if you take a look over here, these are your IFAKs. Notice how small they are, because again, they're individual first aid kits. And when it comes to that, there's all the components that's actually in it that you would need when it comes to training or if it comes to an emergency. So here you go, be what we call a BOLO, or be on the lookout. What is an IFAK? What is inside an IFAK? When do you use an IFAK? And also the last part is putting it all together. What exactly is inside of an IFAK? Today's IFAK is totally different from that of the first aid kit from way back when you used to have Band-Aids. Instead, it's now designed to address immediate life threats such as exsanguination, which we call bleeding out, airway breathing issues, and hypothermia. So what exactly is inside of an IFAK? They are configured to address the most likely risk and specific to the training that a person has received. So basically what we're saying is there is no uniformity for an IFAK. That's the biggest thing, but there's no uniformity. Your IFAK is actually made for the IFAK that you have is based on your training and what you know how to do and what you can use. The IFAK of a combat medic is going to be totally different of the IFAK of a regular civilian. Because again, a combat medic or a SWAT medic or even EMS, they will be able to do more advanced applications than that of an actual regular citizen. So you're looking at advanced airway. So for us, an NPA is all we can do, or pharyngeal. But for EMS or combat medic, SWAT medic, they're able to do what we call intertracheal tubes. And they're also able to do a combi tube, something of that nature, is a little more advanced. They're also able to start IVs. We're not able to start IVs as civilians, but on the EMS side and on the combat medic side, we are able to start IVs. We're able to do chest decompressions. As a civilian, you're not allowed to do that. So be mindful of that. That is beyond your scope of practice. So if you're doing something like that, you're more prone to get sued. However, on the EMS or the combat side, we're allowed to do things of that nature. What exactly is inside of an IFAK? Like I said, there is no uniformity, so every IFAK is going to be totally different. These are the 7 things each IFAK should have, just the common things. A nasopharyngeal airway, also known as the NPA, exam gloves, 2-inch surgical tape, trauma dressing, combat application tourniquet, or we'll call it a CAT tourniquet, a chest seal, and a quick clot. So when it comes to the nasopharyngeal airway, the NPA, this is used to maintain the airway. The NPA is inserted through one nostril to create an air passage between the nose and the upper part of the nasal passage. So if you take a look over here at the diagram itself, this is how you insert it.
Select the correct size nasal airway. Begin by visualizing the patient's nares and select a nasal airway with a diameter slightly smaller than the patient's largest nare. Once the diameter is determined, then measure the device from the tip of the patient's nose to the tip of the earlobe or angle of the jaw. The rubber washer or grommet can be slid back and forth on the device to ensure a proper fit. Lubricate the distal surface of the airway with water or a water-soluble lubricant. If inserting the nasal airway into the patient's right nare, insert so as to follow the normal anatomical curvature of the nasopharynx with the bevel toward the septum. Direct the nasal airway along the floor of the nose into the oropharynx.
Exam gloves. And these are very important because, again, people say that your hands or your skin is a barrier between fluids and things of that nature, as long as you don't have any cuts. But how do you know if you do not have cuts on your hand? That's the thing. So always use gloves. It is important that you be mindful of the type of gloves you use. A lot of people are using latex gloves, but they have latex allergies. So again, when it comes to that, it's easy just to go to nitrile because again, there's no latex. You don't know if that patient or that client has an allergic reaction. So it's easier to go to nitrile. So there's no allergic reaction when it comes to that. Another thing is light gloves versus dark gloves. I like to go with the light gloves, like your white ones, your blue ones, light blue, something of that nature compared to your black. There are some people who like to use the black ones, but during a trauma sweep, when you're looking for a massive hemorrhage or blood, something of that nature, and there's black gloves, you're not able to distinguish between that of the different types of body fluids. Is it actually sweat or is it blood you're looking for? However, the light colored gloves, you're able to see, hey, that's actually blood. So we need to go and take care of that instead of, oh, that's just sweat. We don't have to stress that. So again, be mindful of the type of gloves you use. In addition to that, make sure you have multiple pairs in there because sometimes it could get messy. You may have to change up gloves. So if you use one set of gloves and it gets too bad, you may have to switch out. So be mindful of that. 2-inch surgical tape, very interesting. This pressure sensitive adhesive tape used as a bandage to hold dressing onto a wound. One thing is very interesting. Did you know that the actual white tape that you see in the hospital and things of that nature contains zinc oxide? And this is to help reduce or prevent infections, bacterial infections. Your trauma dressing, when it comes to that, you have two sides. You have the left side, the Israeli trauma dressing, and you have the Israeli trauma dress bandage. You have the right side, the multi-trauma dressing or large pad. And both of these are perfect based on price, whichever one you get a hold of, that's fine. Me personally, I like the Israeli one because again, it's a little more detailed and it helps with direct pressure. So take a look at this diagram. This is your Israeli dressing. Notice on the left side how you actually apply it.
Situate the wound beneath the bandage in between the label and the pressure applicator. Begin wrapping the leader around the arm below and above the pressure applicator to maintain the dressing pad in the position on the wound, covering it completely. When the wound is secure and protected, engage the wrapping leader in the pressure applicator by bringing it through the opening of the bar at the top. Wrap the leader back in the opposite direction over the pressure bar so the pressure bar is fixed directly on the wound site.
CAT tourniquet, also called your combat application tourniquet. It's funny because many people hear CAT all the time and don't know what the actual name stands for. And again, the name of it is a combat application tourniquet. Short or abbreviated is CAT tourniquet. This is used for bleeding and hemorrhage control. And again, if you have a stop the bleed class, take a stop the bleed class so you know how to properly use this. Because many people don't understand, you use the CAT tourniquet for actual hemorrhage control or arterial venous blood if it's squirting out. That's when you use it. Most people say, oh, you got a scratch on the arm, let's use a tourniquet. No, that is not how you use it. So again, it's important that you take a stop the bleed class or you take some type of class to teach you how to correctly apply a tourniquet and when to use a tourniquet. These are steps of it. Step 1, slide your appendage through. Either it's an arm or a leg, you slide it through. Step 2, pull the end of loop as tight as possible. Fasten hook and loop fastening system. Now you take the twist winding rod till the blood, or you twist the winding rod till the blood actually stops, or the flow of the blood stops. And you set the winding rod into the retaining clip. You secure the winding rod by folding it down in the hook loop strap, and you record the time. I like the CAT tourniquet because again, this can be used for, this is one-handed use. So basically you can apply this yourself or you can apply this to somebody or somebody can apply it to you. But I like this again because if I'm by myself, I can actually apply this to myself. Again, one-handed use, hemorrhage control, use of arterial venous blood for moderate to severe bleeding. And for use of extremities only, that's the biggest thing, use of extremities only. You do not use this with packing a wound. So again, you pack a wound, as you pack the wound, you notice that it's not working and this for extremity. If you're packing a wound on the arm or leg and it's not working, then go to the tourniquet. So again, that's how that works. Vented chest seal. So if you take a look at these, you have a hyphen vent. These are the ones I actually like, easy to use and very simple. And that's how you do. It's like a sticker. You peel the sticker, place it over the chest. It helps. It does everything else for you. So chest seal application, step by step, you expose the patient's chest, wipe away the blood or any fluids to identify the location of the wound. You apply the chest seal. Again, this is for a chest wound only. You get shot in the butt or the thigh, you do not use this. You assess the opposite side of the patient chest as well as the exit wound. So if you take a look at the diagram, you notice what's going on. This is the diagram of it. So again, first, step one, wipe away any blood wherever the wound is so you can actually identify where it is. Step two, peel away the sticky part of it, peel away the adhesive part. Step three, you apply it to the chest itself where the wound is. And in step four, you reassess or you assess the patient to make sure that the seal is a good seal. Your quick clot is used for packing a wound. I love this one because, again, it's used for hemorrhage control. It's a gauze roll, it's absorbent, it's thorough, it's safe, and helps control bacterial growth. And if you take a look over on the right side, you have your combat gauze, your quick clot, as well as your quick clot at the bottom. Again, these are perfect. A lot of people say, I'm going to military style. It doesn't matter. As long as you have one and it's a quick clot, it helps. This is for packing a wound. So again, understand that you can use a tourniquet for your extremities, but if there's shot or there's a big gouge in some body part, you can actually use this to pack the wound. And I love this. This is very important. You will definitely learn this in a Stop the Bleed class. This is Eric Whiteside with Whiteside Tactical Solutions. If you're looking for first aid CPR, Stop the Bleed, or any type of medical such as your TECC, Tactical Emergency Casual Care, we actually provide those courses. We are backed by the TECC co-foundation as well, co-company. So take a look at our website at whitesidetacticalsolution.com. Again, that's www.whitesidetacticalsolution.com. You see all the courses we have available for you. Until next time.